Our study is entitled Perspective of Filipino Rehabilitation Students on Interprofessional Education. So, what is IPE? According to the World Health Organization, it is an experience that occurs when students from two or more professions learn about, from, and with each other. Also, according to the American Occupational Therapists Association in 2015, entry-level occupational therapy curricula should include interprofessional education in which students have opportunities to learn. Why is IPE important? Imafuku said that IPE builds the foundation of interprofessional collaborative practice. According to the faculty members in Barron's study, students who underwent IPE could become future change agents and even ambassadors to improve IPC in the workplace. Students also improve their self-confidence, academic skills related to poster and conference presentations, as well as gaining communicative interprofessional competencies. Lastly, Barr, Lapkins, and Reeves also said that evidence shows IPE is related to increased patient satisfaction, improvements in clinical decision-making, more effective collaborative team behavior, and enhanced attitudes towards IPC. How are IPE programs implemented? In the US, simulation-based experiences, didactic activities, real-world activities led to students having significantly more positive perceptions about IPE. Japan shows evidence that laboratory work on an interprofessional team and lecture-based interactive learning units led to a better fundamental understanding of communication/teamwork and interprofessional collaborative practice. In addition, 8 teaching learning strategies used for the IPE implementation in the Philippines were classified by C, namely lecture/didactics, small group discussion, case discussion, apprenticeship/mentoring, simulated patients, and online with OTs, PTs, and SLPs as participants. Among these IPE teaching learning strategies, didactics, and case discussion in a community setting were found to yield a more positive attitude towards IPC among the respondents. Given the outcomes of these studies, these are also what we aim to see in the IPE program implemented in UST's CRS. It was seen that most of the studies gathered were conducted internationally, but when it came to the local Philippine setting, only a few were published. IPE is a relatively new course that refers to other countries to model it, though its implementation is rather vague in a sense that it is still in progress. With a vast field of healthcare professions, encouraging interprofessional collaboration is highly dependent on how one institution conducts the course. Even the students' allied health programs influence how the program is conducted. Lastly, there was little evidence when it came to IPE in a rehabilitation context. Though there were some studies that included rehabilitation sciences students, such as OT and PT, there were still no researches conducted specifically for the perception of a rehabilitation team. In relation to this, the College of Rehabilitation Sciences of the University of Santo Tomas has recently implemented its own IPE program, making the topic more relevant with the development of the said course. This is where our study comes in. We aim to determine the perspective of Filipino rehabilitation students on IPE. These perspectives will give us a clue if UST's recently implemented IPE program is at par with the aforementioned literature, and perhaps gain points of improvement from the respondents as the course is being developed. This is significant because the faculty of the College of Rehabilitation Sciences would be able to provide quality management by assessing areas such as barriers to improve on and facilitators to strengthen, thus developing the course into a more ideal and efficient one. Practicing communication between different programs would serve beneficial for undergraduate students who are yet to enter internship, as it encourages them to communicate with other professions and collaborate on course outputs. The study would be able to raise concerns with regards to the implementation of the course and what could have been done to improve upon it. With continuous quality management being implemented by the college administration and faculty, the future undergraduate students may experience a more improved course implementation. Future patients or clients would be the end stakeholder or recipient of the outcomes provided by the IPE course, as it enables the professionals to work collaboratively for their benefit. Future institutions that hire graduates or accept the students for internship who both completed the IPE course may see the benefits as they practice and easily collaborate with different sets of teams in the said institution. Lastly, Future researchers may benefit from the study as they may look into the different parts of the research study and they may be able to utilize it in their research paper. Let's go to the specifics. Our population would be the cohort batch of UST-CRS students who underwent the IPE course. It will be set in UST Sampaloc, Metro Manila, Philippines, and the mode of course instruction for IPE would be enhanced virtual learning mode. The time frame would be the academic year 2021 to 2022, and the interviewing of participants will take place after taking the IPE course. The research design is qualitative. The study's limitation would be that the study is qualitative in nature as its quantitative counterpart is conducted by another research group. With all this being said, it is true that IPE is indeed important. As said by Phil Jackson, the strength of the team is each individual member. The strength of each member is the team. This has been Group 1 of 2 OTA, and thank you for watching.